In a complete U-turn on what we did before, I'd like you to put all your phones away, all your laptops away, close them down, none of you are that important, sorry, and listen, please, thank you. So, good morning everyone, my name is Claire, and I'm here today to talk to you about my daughter Beth. And before I talk to you, I'd like to introduce you to her via a few photos.
You were my little one, the gift I could give. I was the lucky one to receive someone so precious. I'm grateful to see. You were the miracle in me. You were my little one. You woke up my heart. I never thought anything could tear us apart. You showed me the universe, how sweet my life could be. You were the miracle in me. You are my little one, wherever you are. Alone in your darkest night, I'll be your star. I'll be the morning dew. I'll be the falling leaf. You are my little one. Someday you'll know I'm only a breath away wherever you go. I'll be the summer breeze that whispers through your dreams. You are the miracle. I'll be the summer breeze that whispers through your dreams. You are the miracle in me.
I'm here to talk to you today about my daughter Beth, my family, and how at 6:15 p.m. on the 27th of July, my family's world as it was ended. We were a normal family of 5, we are now 3. I'm not a medical person, and the little that I know is learnt by 3 generations of my family, all being affected by the condition hereditary spherocytosis. My father had his spleen removed over 50 years ago. My brother and I had our open splenectomies in the 1980s. Because of this family history and the knowledge you gain as parents of 3 children, all affected, my husband Richard and I gained a level of reassurance that the condition was manageable by an operation that was routine in any large children's hospital. Over time, new operative techniques develop, and Will, our 2-year-old middle child, who had a severe form of the condition, was the first in our family to have the operation laparoscopically. The brilliant outcome of his operation and the improvement in his quality of life meant on our arrival at the hospital on the 26th of July 2006 with our 5-year-old daughter Beth, due in for the same operation, we had high expectations of an equally brilliant and a successful outcome. Beth was our eldest child. She had a milder form of the condition but was still tired and struggled to keep up with her peers. Beth's operation was much more planned. We'd met the surgeon who told us how the operation was going to proceed and how they were planning on getting Beth's relatively large spleen out through a fan and steel incision so as to minimise visible scarring. On the day of the operation, the junior doctor came to gain our official consent. Everything as planned, he said. No need to talk about complications, they aren't going to happen. We had an unusually high level of trust for this doctor and the other surgeons, as they'd all taken part in Will's operation. We took our beautiful, amazing daughter down to theatre. We kissed her and said everything would be okay and that we would be here when she woke up. But that was never to happen. 6 hours after we'd seen our daughter alive and happily talking away as usual, blood-stained surgeons, nurses and the anaesthetist walked into our tiny hospital room with no warning to tell us that there'd been a problem. Something awful had happened. I had to ask them the question. They couldn't say it. Is she dead? Yes. We cut through a blood vessel and she bled to death. They were in shock, were distraught, and I was hysterical. After a short time everyone left. At this point we were to all intents and purposes abandoned by the hospital. Relatives helped us home. We then had to tell our 3-year-old his sister would not be coming back. Richard said this was the most difficult thing he had ever had to do. Then bereavement services at the hospital cancelled appointments that had been made for us by the nurses, and no one returned our telephone calls. 4 days after the operation, we'd had enough of being ignored and demanded to be seen. So to try to deal with the utter devastation that surrounded us. My husband Richard and I arrived at bereavement services to be told there was nothing they could do as we lived outside the area. Goodbye and here are a few leaflets, was their response. We went up to the ward to collect a picture Beth had painted before she went to theatre, only to find it had been thrown away. How could they not understand that everything Beth had ever touched had now become precious? Then in the ward everyone appeared, doctors, surgeons, nurses. We were sat down and told a very different story to what we'd been told on the first day. The surgeon had been at the autopsy and they informed the pathologist she doesn't think that blood loss was the cause of Beth's death. The team have just met with the board. They have stated we don't know what happened. We left that day more confused, hurt and upset than ever. We went home to bury our daughter. We didn't understand how their story could change so much. But as parents you can't leave it there. We had to know and understand why our daughter had died. At first there's a feeling of urgency, that if you can understand you can go back and make it better, fix things. When your child dies, your head knows they are dead. You've just organised their funeral, but your heart does not yet know. In your sleep you dream of ways to save them. In your waking hours you search for that question that once asked can unlock the path to bringing them back, as if you can dig up their body and make everything okay. It took 5 months for me to finally realise in my heart she was dead. This is why it is so important to listen sympathetically to patients and parents and help them with their questions. They are searching for that perfect question. But eventually you realise you can't bring your child back, but even then you would give up all of your worldly possessions just for 5 minutes with your lost child. The questioning later turns to a sense of protection. The only bit left is memories, and you simply must know everything. We fought for copies of Beth's notes, which turned out to be woefully inadequate in places, and revealed huge errors and incorrectly followed procedures. We had a meeting with the surgeon and found out little by little more information. They'd been using a new piece of equipment, a morcellator, a rapidly rotating blade used to dissect organs internally. A trainee surgeon had been using it at the time of Beth's collapse. It was the only piece of equipment in use at the time. Beth's deterioration was rapid and complete. We had to fight for every detail to be released. If we didn't ask, we weren't told. Richard and I were way over our heads. Neither of us had the level of medical knowledge needed, and no one helped us. It was very stressful, and Richard could hardly sleep. The hospital board confused and clouded the issues, allowed us to follow irrelevant lines of inquiry so as to distract us from the main issues. The hospital had thrown away the evidence that could give us a clear answer as to what happened. The bag in which the spleen had been, the disposable parts of the morcelator, and most importantly the blood that Beth had lost during theatre. They had not kept records that are compulsory in a theatre, such as labels from blood transfusions. We had no accurate knowledge of how much blood Beth had been given. We were getting nowhere. The hospital didn't want to investigate, and our lines of questioning only led to more questions. The hospital were letting us fumble around in the dark. We enlisted the help of a friend with medical knowledge to come with us to a meeting, and here things started to become clearer. The hospital finally had a qualified opponent. We found out they had not gained proper informed consent to use the morcelator. The operating surgeon had 5 minutes training, undocumented, from a surgeon who had seen the morcelator in action 5 years previously. They had completed no risk assessment and had not followed correct procedure in implementing a new technique into surgery. They made no attempt to retrieve the discarded items, even though they were still in the building, and a surgeon said she realised that they were important. The surgeon with experience in this procedure was out of the operating area watching the view of the internal camera. This was only the third laparoscopic splenectomy the surgeon had ever carried out. Will had been her first. The procedure had never been done on a child anywhere in Europe. What mindset did those doctors have that day to think they could carry out a procedure with no risk assessment or thought to human error? It was the surgeon's third ever procedure of this kind. Did she not stop and think the introduction of a new technique was a step too far? They would add extra pressure to the whole operation. One part of the situation that shocked us was that before the morcelator was used, the team had wasted 45 minutes attempting to put a large spleen into a broken bag. They lost track of time and their environment at this point. When they were questioned, they'd estimated this part had taken no longer than 10 minutes. And that, of course, if it had, they would not have continued to keep a child under anaesthetic for the cost of a bag. They would, of course, changed it. But the video showed the correct time and proved that the doctors can lose awareness and clarity of thought in these situations. The team had walked into theatre that morning, found the morcelator was free in the gynecological theatre, and a chance remark of, "How about using a morcelator?" resulted in a catastrophic tragedy. The team had had a quick briefing, asked a nurse who had never heard of the equipment to put it together, didn't read the manual or the safety instructions. The manufacturer of this equipment refuses to put it into a hospital without giving formal training sessions. They only had it because of its use in hysterectomy operations. Many rules were broken by moving it to new departments and not receiving formal training. They decided to use a bag to hold the spleen whose instructions clearly said not to be used with a morcelator. Why? Why did they break rules? And what procedures should have been in place to stop them? Maybe they thought it was a reasonable risk. Well, just because a risk seems reasonable to a surgeon, it doesn't mean it's anywhere near reasonable to a parent. Their feelings must be taken into consideration. The team completed 2 operations that morning, then turned without any further briefing to Beth. They didn't stop for 1 minute to consider my child. Not one of them said, "Hold on a minute, should we stop back here? Think about this. Is it right to go against so many hospital and manufacturer procedures and rules?" If they had, my daughter would still be alive today. But the horror doesn't end there. We continued to hit brick walls in an unrelenting denial from the hospital, with no open release of information. We were told once that the information we requested was not available. However, if you have a legal team, it would be. We finally appointed a solicitor, but the only way to afford this was to bring a negligence claim, something we'd never wanted to do. I say at this point, and I speak for the vast majority of parents in my situation, the fight is not for a second about money. Why would it be? What would you do with it? Buy a new conservatory, new TV? Well, we won our negligence claim. The hospital admitted they failed in their duty of care, and we were awarded £10,000, apparently the value of a child's life. We paid for the installation of an adventure trail at Beth's school, so in a way she can still make other children happy. A horrific 3-day inquest followed. I had to sit there and listen to the events of Beth's surgery from numerous people. It was like being tortured with no possible escape. Richard said he couldn't even leave as they showed pictures of Beth's autopsy. "I failed Beth once," he said. "I won't do it again." And so a so-called specialist was brought in. He'd never seen a mortilator before, yet his evidence was held in the highest regard by the coroner. He stood on the stand and said in response to the issue of consent, "Well, I use new pieces of equipment all the time, adding risk to patients. Don't see the need to inform their parents." Yet the rules on consent are clear. You must gain proper, informed consent. The coroner failed to get to the root of the problem, to uncover why this had happened, and the human factors were never mentioned. This is when I realised not all surgeons are the same. Some believe they don't make mistakes, therefore human factors training is irrelevant to them. They're so detached from the patient has become arrogance and a misguided belief of infallibility that suppresses the needs of patients and their families. I heard a trainee surgeon say under oath he believed his 5 minutes training on the equipment that day was sufficient. Who allows him to make that kind of decision? What is a surgeon thinking when he believes he can operate on a small child without thought to procedure or human error? We all make mistakes. It's how we prepare ourselves and we learn from them that matters. Together we must make all medical staff in this situation step back, think about what's happening, involve everyone in the thought process, nurses, patients, families, the whole of the team. Take things at a considered pace. After an event, all we wanted was someone to say sorry. Not to be told to say sorry, but to say sorry themselves. We don't know exactly what happened. We will find out, make sure everything was done correctly, and we will learn from this. That's all you want, someone to learn from what has happened. And then for them to follow through with an openness, compassion and honesty to the point of allowing themselves to be found at fault. An event like this ruins the lives of families, surgeons and nurses. On February the 12th, 2008, Richard, completely out of the blue, died of a heart attack, aged 31, I believe brought on by the stress of the preceding 18 months. I raised my 2 little boys on my own, and I will work until all doctors understand human factors and then incorporate them into their work every day. I spoke to the surgeon involved a while ago. She still doesn't understand that her decisions are flawed that day. However, she does accept that the choices she made affect many lives and continue to do so every day. And I was asked by a fellow speaker one day why and how I put myself through days like this, and why I speak out and tell my story. Every time I do this, I force myself to relive the worst days of my life. The pain is something none of you, unless you've been in that situation, can understand. I do this because you need to understand that one day the people you are responsible for will be in a situation where their decisions could destroy lives. You all need to comprehend the consequences of your actions. You hold many lives in your hands every day, and you will find yourself in a situation where your action or inaction will kill someone. I'm not sorry for the strength of my language. It comes from the strength of feeling and the need to get you all to hear how important prevention and accidents and openness is when they occur. I started the chain of events that led to Beth's death with a simple comment of my scarring that I suffered during my operation. It led to the awful events of the 27th of July. The cultural environment at the hospital, I don't believe, was such that people were scared to speak out. Simply it was misplaced trust of each other and not enough questioning or inquiring. I have no perfect answer as to how you develop an open and inquiring culture, but I do know that human factors is the key to making this change. Giving people a voice and, more importantly, the confidence to believe they will be heard with respect. Many things have changed in hospitals since Beth's death, but nowhere near enough. The change needs support from the highest level, and patient safety needs to be prioritised in all decisions you make. And the rewards, both in care quality and financial costs, will be huge if we all work for this. We mustn't stop talking, please. Discuss these issues until everyone understands mistakes will always happen, but we can minimise them and prepare for them with teamwork, training and support. And we must realise that telling the truth and treating everyone with respect after an event like this is all that matters.